Joining me now is Congressman Henry Waxman of California. He is the ranking member of the House Committee on Energy and Commerce, which will hold those hearings on the health care rollout. Thanks so much for joining me this afternoon, Congressman.
Pleased to be with you.
Before we get to health care and the upcoming hearings, I want to ask you a quick question about the jobs report that came out today. We sort of got a mixed bag. We heard Jason Furman tell reporters in the White House press briefing room earlier today that he thinks the shutdown, the government shutdown, is going to have a real impact on jobs reports moving forward. Do you think that's accurate, Congressman?
Yeah, I think it's correct. A lot of people have been very concerned about whether they're going to have enough money to pay their bills while they face this government shutdown, whether they're federal employees or government contractors. And that may well impact their thinking about how they'll spend for the holiday season. But look, this shutdown was terrible. It did no one any good. It hurt our economy. It demoralized our federal employees, and it made us look ridiculous all around the world. There was no excuse for it.
All right, Congressman, I want to get to health care now. As you well know, there are a lot of questions about the website, but it seems like the key questions are what is wrong with the website and when will it be fixed? Has the administration given you any sense about timing or whether or not this is a structural problem? You just heard White House Press Secretary Jay Carney answering questions about that.
It's an unfortunate problem because we had hoped that the whole website would be working at this point, but it is something that I believe is fixable, and you can get from Jay Carney and from the President of the United States their clear determination to be able to make it work. It's not the only way.
Do you have a sense of the timeline, Congressman? Do you have a sense of the timeline at all?
December 15th is a key date for the insurance to go into effect on January 1, but there's a 6-month period for people to enroll, so it is something that can be fixed. The sooner the better, but December 15th is an important date.
I want to ask you about these reports that we got today that there were major red flags before the system was launched. Based on what you know right now, was the President or Secretary Sebelius made aware of those problems before this system was launched?
I don't have any information about that, but no one could have possibly known how bad the system would work when it was implemented all around the country for the millions of people that want insurance and have tried to access the website. So if it worked well for a smaller group, it turned out it didn't work well enough for a larger group. That often happens. I know in the area of prescription drugs, a trial on a small group may not be indicative when a large number of people use it, but it is a problem. It needs to be fixed, and it shows how anxious people are to get the health insurance that they've been unable to get in the past.
Congressman, as you know, some Republicans are saying that these problems suggest that there should be a delay to the individual mandate. Is that a fair point? Should the individual mandate be delayed because people are having trouble getting on and signing up?
I don't think it should. We should have a delay for the individual mandate. The individual mandate indicates that everyone has a responsibility to get health care in order for the health care system to spread the costs out. Otherwise, we'll be paying just for those who get sick and are highest risk of getting sick. And their insurance is going to be unaffordable unless others are in the pool. So I'm not so quick to say we ought to postpone the individual mandate. This is only the 3rd week of the rollout of the website, and it doesn't even go into effect until January 1, and I think throughout 2014 people will be insured, and they'll be able to meet the requirement that they have a responsibility to meet.
And Congressman, just very quickly, yes or no, should Secretary Sebelius keep her job?
Absolutely. There's no reason for her not to continue on as secretary. She's done a terrific job. I have a great deal of confidence in her. She doesn't know about all the technicalities. That was contracted out to the private sector. And the private sector, with all the money they got, couldn't develop the website that we needed. It shouldn't have been done by government, but we should have had more competent people in the private sector. And if anybody's head should roll, it should be the contractor who didn't live up to their contractual responsibility.
All right, Congressman Waxman, thank you so much for your time this afternoon. We really appreciate it.
Good. Thank you.